There we go. And good morning, everyone. Welcome to our May meeting. It's great to see all your faces are on the screen. Thank you for coming in this morning, so to speak. So today is the first installment of our presentations around the UN SDGs. Personally, I'm really excited about this little project that we're kicking off just because it gives us a different way to frame the work that we all do. And I'm also really excited to learn more about like the in-depth work of each organization in our association. So I just wanted to start off with a little bit of review of the SDGs before we jump into each individual presentation. So the Sustainable Development Goals are a universal call to action to end poverty, protect the planet, and improve the lives and prospects of everyone, everywhere. And they were adopted in 2015 by all UN member states. In September 2019, the UN Secretary General called for a decade of action, pledging to mobilize financing, enhance national implementation, and strengthen institutions to achieve the goals by the target date of 2030, leaving no one behind. However, we all know that 2020 took the planet by storm, and much of the progress made toward meeting these goals was lost in a matter of months. According to a report that I can share with y'all later entitled "A Decade to Deliver the SDG Reckoning," 12 of the 17 SDGs are materially behind schedule to meet the 2030 deadline, and 10 have been negatively impacted by the pandemic, setting expectations for delivery even further back than originally feared. So, you know, if we ask ourselves the question, why now? Why are we focusing on the SDGs now? I mean, really, we have 10 years, give or take a little bit, to deliver on these goals. And it is critical now more than ever to have a sense of urgency around them. So the hope is that this decade of action that the UN has launched will mobilize people everywhere, demand urgency and ambition, and supercharge ideas into solutions. So the following presentations will highlight how our member organizations are working towards meeting this critical deadline. And with that, I'm going to hand it over to Angie and the presentation from Hope for Kids International.
Great, thank you, Anna. Hello, everyone, good morning. My name is Angie Simon. I'm the Vice President of International Development for Hope for Kids International. I think you know my colleagues, Mark and Kelly. They've been a part of the AGD network for a while, but I'm excited to be with you guys this morning. So thank you for having me present. If you're not too familiar with Hope for Kids International, I'll give you a little snapshot of who we are. We're a Christian nonprofit organization located right here in Phoenix, and we've been around for nearly 50 years, restoring hope to children and families that have been affected by extreme poverty and disease. We've drilled over 800 water wells over the last 15 years. We built a number of schools and medical clinics, and we sponsor nearly 3,000 AIDS orphans and vulnerable children around the world. And we lead about a dozen mission trips to our international projects in these developing countries, so people will get to know the poor and learn how they can make a difference to end poverty, at least in the lives of a child, a family, or a community. Which brings us here today, discussing the UN's interlinked Sustainable Development Goals for 2030. Sustainable goal number one, no poverty, end poverty in all of its forms everywhere. While we are so closely linked to number 6, clean water and sanitation, I'm going to take a shot at addressing water and how it plays a big role in the different dimensions of poverty. You know, before COVID, according to the UN, the world was making significant progress, you know, to coming close to ending poverty by 2030. I think their graphic said that we were projected to be at 6%. On the onset of COVID, we started seeing the first increase in global poverty in decades. 37 million more people were pushed into extreme poverty in 2020. Extreme poverty has gone up at least 7% over this last year, ending a 20-year streak of progress, according to the University of Washington's Institute for Health Metrics and Evaluation. That's 37 million more people surviving on the equivalent of less than $1.90 a day. And those people are now referred to as the new marginalized. COVID has exacerbated extreme poverty, and we here on this call have a lot of work to do. The Wall Street Journal said this week that most lower income nations are struggling, reversing decades of progress and alleviating global poverty. And they said that this has become the inequality virus. I thought that was so profound. The article said that the economists predicted that the rich countries in the world would only grow richer, while the developing world, where people are largely unvaccinated, who are not benefiting from a stimulus plan, will only get poorer. This disparity is widening. But who is suffering from poverty? You know, I would argue that everyone, all of us, suffers from some form of poverty. In the West, we tend to think of economic poverty, right? Malnutrition, poor sanitation, no access to clean water or basic health services. Compassion calls it spokes on a wheel, and there are many different forms of poverty. There's social poverty, where you're oppressed or have no voice. Educational poverty, not having the opportunity to obtain a quality education. Health poverty, when your physical or emotional health suffers. And spiritual poverty, the feeling of absolute hopelessness. So where do we go from here? You know, at Hope for Kids, we address these forms of poverty through our 4 pillars of hope, and that's through dignity, health, joy, and love. Dignity by putting shoes on the feet of a child, sending children to school to escape the grips of extreme poverty. Health, we're drilling wells in areas where people are fetching their water from ditches. Also, along with constructing sustainable medical clinics. Joy, we're installing playgrounds. I think we've done it in a few countries so far. You know, the children that we serve have already lived a lifetime of suffering. So any time that you can make a child laugh, you know, is a great day. And love, and everything that we do is because of the love of Jesus, just showing people love. But Water for Kids International, this is our program that's on the front lines. It's our first response to alleviate the misery and the hopelessness that comes from not having access to the basics, like clean, safe water. You know, when you talk about the suffering from the lack of something so basic, like water, you know, it's really hard for us to understand. You know, especially in 2021, in this golden age of technology, you know, that people today, 750 million people still do not have access to safe water security. You know, we don't have anything in our Western experience for us to fully understand how these people suffer, you know, every day. You know, the analogy that comes to mind for me is an iceberg. You know, we tend to think of like dehydration and dysentery as the ways people suffer from not having access to clean drinking water. You know, it's that part of the iceberg that, you know, sticks out of the water, right? But we've come to understand the trials, the tribulations that women and young girls in developing countries have to face each and every day when it comes to water. You know, it's considered a domestic chore, and they're the ones that are responsible for fetching water for their families. And they're walking miles each day, you know, not to a fountain or a hose, but to a contaminated open pond filled with frogs, life-threatening bacteria, animal waste, snakes, and they're drinking it. Not because they don't know the difference, but because they don't have another choice. Young ladies are getting violated in the bushes, kids are drowning. Oftentimes girls don't have the opportunity to go to school. Women have to walk many hours trekking for water, coming home to abuse by their husbands. The number one killer in East Africa is malaria, which is transmitted by female mosquitoes breeding in the stagnant ponds where the children are collecting their water in the morning and the evening. And any little money that these families can save is trying to keep their kids alive from dysentery, cholera, typhoid. You know, we've heard the statement over and over. If they quit having children, they wouldn't be so poor. Have you ever heard that statement before? But in these remote villages, sometimes the infant mortality rate can be as high as 50% because of the illnesses associated with dysentery and these other waterborne diseases. Their life is the poorest of the poor, and you begin to see the world suffering as it relates to water. It's a grim life filled with little hope for many women and young girls. Recently, I've been reading Tracy Kidder's Mountain Beyond Mountains. It's about Dr. Paul Farmer's work in Haiti. And he talks about poor countries and how it relates to the misery index. You know, and I couldn't help but think about the women in Africa. He says they are particular people, but they have to blow their noses in their dresses because they don't have any tissues, wipe their bottoms with leaves, and have to apologize to their children for not having enough to eat or clean water to drink. They have the grim necessity of giving this dirty water to their babies. They have surrendered to death, disease, misery, and hopelessness. You know, if we had more life-saving wells, like this well behind me, this is called a borehole or a well, we could eliminate many of their problems. You know, take for instance, Mary. She could eliminate most of her time walking for water. She could stop waiting endless hours at a contaminated water source. Instead, she could spend that time learning a trade like tailoring or sewing. She could start an income generating activity that could afford her family other choices in life. Better yet, she could have time to grow her own garden that would provide enough food for her to feed her family, and she can sell the rest at a market and have the dignity of providing for her family. And then Catherine can send her children to school to obtain a quality education to end that cycle of extreme poverty. And the ripple effect doesn't stop there. Catherine's children will teach their children the importance of education, the value of drinking safe water, and the importance of using good hygiene practices. You know, the thought of drinking from a dirty, contaminated pond that they share with animals will be erased as an option, just like it would never be an option for us. And it's in that moment when you are ending poverty. Many people in development have an interest in clean water, but they may not even know it. If you're an educator, you're also for water. If you're for social justice, you are also for water. Women's and children's rights, you're also for water. Economics, politics, healthcare, gender equality, sustainable communities, it all starts with water. The phrase water is life takes on a deeper meaning, doesn't it? It affects every aspect of our life. A life-saving borehole or a well can change the trajectory of a village for thousands of people for literally generations. With little to no maintenance, it can last 30 to 50 years. Over the last 15 years, we've created a scalable program to deliver the highest quality wells to the people in the greatest need. We've drilled 800 boreholes throughout Uganda, Kenya, India, Bangladesh, Liberia, the Philippines, including a really cool water cistern project in Nepal. And the first thing we do is getting the community involved. The ownership piece is critical to the sustainability of any project. We have them donate a piece of land for the well. They host our drillers and our field officers, and we set up a water usage committee to oversee the long-term maintenance of the well. The second thing we do is use the highest grade stainless steel installation materials to ensure that longevity of the well, that those materials are going to hold up over time. And the third thing we do is teaching people the value and the why of drinking clean water. One time we were opening a well in Uganda, and right after, a lady went back to fetch her water from a dirty pond. The pond was actually right next to her home. And I asked her, why, you've got to come to this borehole. Why are you going to this pond? This is dirty, it's killing you. She says, oh, the borehole is very far. It was literally about a half a kilometer from her house. And I said, well, how far is your nearest health clinic? She said, oh, it's very far, like 12 kilometers. I said, if you don't walk to this borehole, you're going to be walking to that health clinic. And it was the most poignant lesson I learned in international development. We can drill a well, but we have to teach people to drink clean water. We have to sensitize them, teaching them the value of drinking clean water. We're teaching them about germs, the invisible particles that can kill you. We bring glitter and have everybody shake their hands, and they see the glitter and how it can't get off, until they wash their hands with soap and water. We teach them about the safe water chain, bringing a clean jerry can to the well. If they bring a dirty jerry can that's filled with oil and it hasn't been washed, and they come to this well, they're still bringing home dirty water, right? So that change comes through sensitization. We have to spend time combating mindsets, human behavior, and customs. The time has to be spent sensitizing them to see real transformation. And as you can see, all of the sustainable goals are interlinked. And some great minds carefully selected all of these for us to focus our efforts to bring about great change in the world. And I hope by providing more clean, safe water security to many more people will help lay a solid foundation to end poverty in all of its forms everywhere. So thank you for listening today.
Thank you so much, Angie. What a powerful, powerful connection between poverty and water. I think the way that you laid it out just makes the connection that much more palpable. So I thank you for drawing that picture for us, right? I'd like to open it up to see if anyone has questions or comments for Angie.
Sure, thank you.
Well, personally, Angie, I would just like to say to you that I really appreciated the data and the statistics. We live in our comfortable homes and we forget. And I really appreciated your reminder. And thank you for sharing your passion. It really came through. Thank you very much.
Thank you. Thank you.
You mentioned about your trip going over. How many engagements have you been a part of personally?
I think I counted one time, and I think it's over 50 mission trips I've been in. I've been to Uganda about 40 times. So that's my home away from home. You know, we are a registered NGO there, so we have a staff that oversees all of our drilling projects there. And so they're just an absolute joy to work with. And we can't wait to go back in July.
We have oftentimes have questions from people that support us saying, should I give money for a well or should I go on this trip? And we always tell them to go on the trip first, because that is such a powerful experience. I went the summer of 19, saw the water source that was named Cobra, Snake, and Large Tree, and that's where they drew their water from. And I saw the celebration in the village over the water source, or the well being drilled. So those experiences for us, especially that, like you said, live in comfortable environments, are so powerful for the people. And our best supporters are those who travel with us, because they get to see firsthand what's actually going on.
Well, thank you so much for that presentation. I think it's a great representation of SDG Goal 1, no poverty. Thank you again. And with that, we're going to move to Goal 3 with a presentation by Jenny.
Hi there, everyone. So I do have a slideshow. Will I be able to share that? Okay, first I do want to just mention I have Annabelle Jensen, the founder of 6 Seconds here, so and Sherilyn Lee, who supports education as a program director in education, develops a lot of the education programs along with Annabelle. And with that, though, I will now, I'll share my screen. So 6 Seconds, we support positive change by harnessing the wisdom of emotions, and we believe that wisdom lies within, and all change starts on the inside. So 6 Seconds is a network of professionals, educators, coaches, teachers, HR people, volunteers, retired educators who want to support children still, and coaching leaders in organizations. This is a map of all the certified network around the world. We have our main offices are in UK, Italy, Singapore, China, both Beijing and Shanghai, Japan, and Dubai. And we also have partners in South America and Brazil, Peru, and we have a lot of supporters, professors in the Middle East who do this support and share these tools in universities. So 6 Seconds, we focus on, you know, different parts of the SDGs, but I think a real foundation is the good health and well-being. But there's also a lot of work we do, obviously, in education, because 6 Seconds was founded by Annabelle, and I'll share that in just a second. But about, you know, it started with education. But a big component of that is good health and well-being for students, and that's social emotional learning. The goal is for good health and well-being for those students, and to help students make the most of their skills and become change makers. We also do a lot of work around climate action, and a lot of the activities and lessons do focus on climate action. And then all of this together builds together as far as like building partners around the world and linking with universities, linking with organizations that support this kind of work. So 6 Seconds was founded by Annabelle and her good friend, Karen Stone McCown. It started with the Nueva School that they founded in the Bay Area. And they started implementing self-science. You see the curriculum there on the left, and they were doing self-science since the early 70s. And then in 1996, Daniel Goleman wrote his book, Emotional Intelligence, and he visited their school as one of the schools actively doing social emotional learning. And when he talked about that school in the book and recommended their curriculum, a lot of people came and said, well, how do you teach this to adults? And so it was in 1997 that Annabelle, Karen, and Josh, you see at the bottom, they founded 6 Seconds as a training organization, and also how to help other schools incorporate social emotional learning in their schools. Since then, it's really expanded, as you saw with that map. But in 2017, they created the pop-up festivals as a way to get these free resources around the world. And we were fortunate to partner with UNICEF, and we've been able to present the pop-up festival at the UNICEF headquarters. And this has really helped get these resources out, because the goal and the mission of 6 Seconds is to spread the skills of emotional intelligence and reach 1 billion people by 2039, which happens to be Annabelle's 100th birthday. So,
I'm old.
so you can see one of the things with this, yesterday we had Mental Health Action Day. Yesterday was Mental Health Action Day around the world. And so we were partnered with MTV, and we had one of the representatives from UNICEF come and speak, and with other people from other organizations. And so it's really just how to spread the skills, and so partnering with whoever we can. We also have our courses are certified with the International Coach Federation, so we do have a whole coaching program. So we work with developing leaders and organizations and supporting training and things like that. Here's a little bit of some of the tools and resources we offer. Foundation again, social emotional learning. You can see here the Know, Choose, Give curriculum is a new curriculum that is developed for university level, and it has a facilitator guide and then participant books for the students. And self-science has recently been redone with Annabelle and Sherilyn. They've created an online EQ educator program, and you receive the self-science curriculum as part of that training. We also have tools like cards to make it interactive and fun. And one of our learning philosophies is fish don't talk about water. So, emotions are kind of an abstract concept, but yet we try to have cards and ways that make it a lot easier to talk about feelings. And I'll share some tools that we use for that. We also have the EQ Gym workbook, which is a really great, if you're just, one-off, you're not doing a training, but you can do the EQ Gym workbook. It's a 6-week program. We do have some guided classes. And we also have the EQ assessments. And these, I'll share a little more in-depth picture in a second, but these generate either the full assessment, which is very good for coaching. We also have brain talent profile, which is great for using with students. And we have something called a dashboard, which is you can look at a classroom or a group and understand the EQ of the group, the different brain styles of the group, and brain talents of the group, and maybe their highest and lowest talents. So let's say maybe connection is the lowest. You can then target how do we build connection in this group. So it's just a way to kind of get down to the nitty-gritty of what is needed. So self-science, just to give you some statistics, this is a case study, and we do a lot of research and case studies to back everything up. It's all, science-based. And this is a case study using the self-science curriculum. And what they found was there was a 25% increase in skills like problem solving, critical thinking, goal setting after using self-science in the school. This is in a 3rd grade class, and so let me see what some of the quotes that the kids had that were so great. So there was a 64% increase. Oh, sorry, my camera. 64% increase in things like I like assignments that challenge me. I develop lots of good solutions, a 34% increase, and I can list reasons for and against an argument, an increase by 78%. So these are sort of the different kind of skills that we can build with these tools. The whole foundation is on this EQ model that Annabelle and Josh, they helped develop. The original self-science in the 70s had about 26 competencies of what helps make emotional intelligence, but over time they've narrowed it down to these 8 measurable skills. And so this model is a circle that you can use for any kind of problem solving. Know yourself, emotional literacy, recognizing patterns, choose yourself, consequential thinking, using optimism, intrinsic motivation, and navigating emotions, and give yourself empathy and pursuing noble goals. So this is just a sample of what the full STAY assessment looks like. And I just want to share this because you can see this person has a very high pursue noble goal. So they are very passionate in their pursuit of their purpose. But you can see the empathy is lower and the navigate emotions is lower. These are some of their challenges. So and this can be sort of a common issue where if you're not navigating your emotion and you're not having empathy, you may not be bringing others on board. This person may be in pursuit of purpose, but kind of like a bull in a china shop. And so how to navigate your emotions so that you can empathize with others and then also bring others to support you and help you. You know, because we need each other, right? We could never do any of this work just by ourselves. So putting EQ into action is just noticing, what am I feeling? What options do I have? And what do I truly want? So what are the skills? I'd just like you guys to think for a second and maybe put in the chat, what are the skills that make the difference, do you think? What skills help us have good health and well-being? What are some of the skills? So if anyone, you could, oh, great, here we go. Yeah, self-awareness, ability to collaborate, building good habits, delayed gratification. So thank you. Communication skills. So these are all skills that we try to perseverance. Very good, Sherilyn. So actually, what I'm going to do now is I want to share a video of the pop-up festival that we've created with these free activities. There's over 60 activities. And I'm going to stop sharing, and I think I'm going to have Sherilyn share. Just because I worry about my internet, and I want to make sure, you know, sometimes it's going so far so well. So let's see.
Yeah, it's going great, Jenny.
I'm going to share the video.
I'm very clear on my end. So let me just bring this up. Share sound. Share. Let's see. So you should all see a screen, maybe with Vimeo. Okay, great. Nodding heads. Here we go. And we made that video for a UNICEF, like a SDG competition to see if we would win, but we didn't win. I think we placed, but it was still a good exercise for us. And now you all can enjoy it. You're muted, Jenny.
There we go. The pop-up festivals were created in celebration of World Children's Day, which is November 20th. So this is sort of how it all started, but it's really blossomed into something that is available to anyone year-round. And it comes in over 34 languages. Here is a sample of, this is a mini pop-up kit, and this particular one is about growing love. And I just wanted to give you a sample of what a lesson looks like. So it's very simple. It gives you an introduction, what is the goal, some instructions, and then always the discussion questions to reflect and help. And this particular one, we're not going to do this because just for lack of time, but this is about love languages. And so the kids are instructed to trace their hand, and then in each finger, they would put the 5 love languages, which are touch, words of affirmation, quality time, gifts, and acts of service, and ask them to brainstorm about what different love languages and what acts they mean the most to them. And so it just helps build a discussion and within the family or within friendships about what does show me love, how can I show you love. So really, it's like fun activity, but yet it brings up really important, concepts, especially, I think any marriage counselor probably does a whole session just on this. But today, I want us just to learn about and touch into what our emotions are and the power of our own emotions. So this is a sample of one of our tools. It's called the EQ Coach Cards. And I'd like you to think about what mix of emotions do you have right now? And it's always interesting to know, the feelings beneath the feelings. And if you start brainstorming, you can a lot of times come up with 10 different emotions you may be feeling at once. And so we believe emotions are signals that they help give us energy. And for instance, anger means something's blocking and in my way. And it's not a bad thing. No emotions are bad. They are just data. And when I did a self-science in my son's class, I forgot to really introduce myself, but I've been with 6 Seconds for 12 years, and my son was in 4th grade at the time when I started, and his teacher let me come in the class and do some of the self-science lessons, and the kids were so relieved, I think, to know that anger is not a bad thing. I think a lot of times they're taught to not display that, but, what is a better way to respond instead of react? So I want to share next, this is the Pluchik wheel. And I have links to all these tools that I'm going to share so you guys can access all of these things. But this is a free tool on our website, and so I'm going to go to the website here and show you how you can explore the messages of emotion. So does anyone have an emotion that they would like to explore right now? Anyone have a burning emotion that's just really, you can feel it? Or it
what about admiration?
Admiration.
How interesting.
Admiration. So similar words would be connected, proud. Sensations may be feeling glowing. What is admiration telling you? It tells you, I want to support the person or thing. How can admiration help you? Strengthen your commitment to a person or idea. And so you can do this with all the different feelings. And then what is the opposite of admiration? Loathing. And also you'll see here, there is a link right here for you to take the assessment. So you can try, you will get the Unlocking EQ report. And so please, go and check that out. And so I'm going to go back to, does anyone else want to do another emotion?
What about apprehension?
Apprehension. Worried, similar words, worried, anxious, typical sensation, can't relax. And what is it telling you? There could be a problem. So what can that help you do? Seek out potential risks and don't ignore the problem. So yeah, so this helps us navigate our emotions in a way of like fully listening to the emotion, because if you don't listen to them, they persist. So it's really, what do we say? Name it to tame it is a famous phrase you probably all heard. So naming it, naming the emotion, what is the message, and what are my choices? So that's our EQ model: know yourself and then choose yourself, and realizing what are my options. Here's some of the basic messages of emotions. Something like anger is letting me know what is in the way, and it's giving me the energy to break through obstacles. And so with the work that you're doing and some of this very challenging work, especially in Africa, and I'm sure for other people, we can really get down, and it can be depressing, but how to, tap into our emotions to keep our fuel, and obviously recharge and take time to take care of ourselves. But, something like disgust. I went into my mom's house, and her refrigerator was very disgusting, but it got me to clean it and help her out. It energized me to give her the support. So that's just another example of how we can use emotions to fuel us. So even more in depth, this is a really great, it's called the Emotoscope feeling chart that you can download from our website, and it gives you even more information as far as purpose of emotions. So let's say, here it is, let's say if you're feeling critical, focus attention on the relationship problem. Or irritated, focus attention on something that goes against your beliefs. So anyway, so I just encourage you, I heard the Dalai Lama recently speaking about how we need to sort of get rid of anger, not to correct the Dalai Lama, because obviously, he's a saint, he's perfect, but, I think he could use a little discussion on how can we use, and he probably knows this, I got to see him speak in India one time, and he spoke that time about your enemy is your greatest teacher. And so that sort of taps into the idea of anger can fuel us. Annabelle had this beautiful exercise we did, looking on the spectrum of that flower, that love and hate are connected. And a lot of times we hate something because we love it so much, because we love something so much. So again, just using those emotions as fuel. This is another great product we have as far as their cards, but this is an online version of the cards that was created in this last year. Thanks to the pandemic, we have a lot more offerings online, so that has been one silver lining. These TFA cards are something you can use for problem solving, and what we encourage people is whenever any kind of issue, what are your thoughts, what are your feelings, and what are your actions? And if in let's say a problem situation, if you could just change one, how could this help you? So let me just show you this tool a little bit. So you can go to this deck and pick out your thoughts, what are we really fighting about? And then feelings, what are my feelings around it? I will say, disrespected or contemptuous, upset, and act, what are my things I would say, complain. Here's one of my favorite ones. complain to someone else, not to the person that you have the problem with. So yeah, that's one of my very bad patterns. So thinking about, well, if I could change one of these, what could I change? And I would maybe look at my feeling around this, because maybe I am upset, but really it's because I do care, and I do care about the person that whatever I'm fighting about. So this is just a great tool, and I've talked to this teacher who had fourth grade students, and the kids would say, "Teacher, we need the cards. You know, we're having an issue, we're fighting, so let's get the cards." And then they'll say, "Well, I thought you thought this, and you were thinking that." And so it's a really great tool for helping work through problems. So I just wanted to share our courses that we offer. So we offer a full-on EQ coach accreditation, but we do EQ educator training. We do have an education vital signs, which is, you can look at the school climate. We also recently added a coaching equity essentials course, which is ICF accredited for coaches and coaching equity, and you know, addressing those kind of issues. So that's something that came out of that George Floyd and the pandemic. You know, it was really developed up because of that. And so here's just some of the links, and I will send this to Anna, and you can share it with everyone. And I just want to thank you so much for listening and inviting me here to speak. And if Annabelle and Sherilyn want to add anything, please do.
I thank you very much, Jenny. I learned a couple of things myself, so thank you. Found a new tool, didn't know it was there. Thank you very much.
Thank you. And Sherilyn, thank you so much. Sherilyn's such a great support. And Annabelle too. Thank you for the encouragement always.
Well, thank you, Jenny, so much for that great presentation. I think it's very timely, right? That we learn more about how to handle emotions that maybe a lot of us didn't even know we had within us. I know personally, the pandemic brought out a lot of things that I didn't know how to identify. And these tools seem like they're just the right kind of thing to help us work through those really difficult things. So a great way to kick us off on SDG 3 about health and well-being, right? Because it's all tied to our mental health as well. Does anyone else have questions or comments for the 6 seconds team?
I just wanted to ask, when you do send teams out, do you send teams out to other countries, or are you training volunteers here in the US that go ahead and present the program once they get over there? I'm just very curious about how that works in the pop-up festivals.
For the pop-up festival, it's something that people can just sign up and download and get. So they'll, you know, it's really kind of on their own. They're able to access. So around Africa, and there were a refugee camp. They can just go ahead. I mean, sometimes the challenge is printing, but you know, each lesson is a simple one-page printout, and then it will refer you to the different materials, which are commonly available materials. But we do have our offices that do certification training in the different regions. So there is an office in the UK, Italy. They do a lot of training in Italian. And then there's Dubai that serves, that office goes to South Africa. Josh, our CEO, he travels a lot, you know, not obviously in the last 15 months. So he's put a lot of time into videos and our YouTube channel, which there was a link in there. I'll share it in the document. So he's been able, you know, to do a lot more like online. But even Annabelle and Sherilyn, they were in China 2019, just the end of 2019. And then for the network, we will have a master class. We call it every 2 years. So just last January, we were all in Mexico. We went to a school called CUDEC, which is in Mexico City. It's actually a K through college, and Annabelle's been working with them for over 30 years and supporting them implementing social emotional learning. And then we all had we had our Australia, Korea, Japan. I mean, it's just so fun. And even just our webinars, you can join our, webinars on YouTube, and people in the chat, they're from all over the world. So it's really a great network. The whole idea of I found my tribe, it's like, this is a tribe and you're all welcome to join.
Well,
One of the
kudos to you
things-
guys, because I know our teams in Africa are so hungry for training and just the tools, and they don't have it very often. So to be able to access some of those tools, I think is really valuable. And this is a type of learning that we haven't seen in, especially in Uganda, and it's a very rote memorization of training. So it would be fun to introduce at some point. So thank you.
That would be great. Annabelle, you were going to say something.
Well, I was going to say one of the things we love to brag about is our work with UNICEF and the opportunity to spread around the world. And so before the pandemic, we actually taught 1.5 million children individual pop-up lessons that had something to do with emotional intelligence or some of the concepts of climate control and et cetera. And we did that through the volunteer of about 10,000 individuals. So we're very grateful for our volunteers too, who get very excited about the program and then have all these free materials to use.
And basically it goes in
I want
those
to link
local.
you with our Dubai office that serves Africa, and we're linked with the Wangari Maathai organization. They've had people come and our Jane Morrison and Lee's her education director. They've gone in those schools and done some training, and besides the pop-up, if you want a little more focused support.
Great. Well, thank you all again. That was wonderful. And I can't wait to share all these resources with everyone so we can start tinkering. And now for our final presentation this morning, Adriana will present on Esperanza's work.
Hello, good morning, everyone. Thank you, Jenny and Angie, for presenting on your organizations. Personally, this was really exciting for me to discover and just to be able to see the connection of our organizations with the SDG Goal 3 and as well Goal 1 for Hope for Kids. I have a PowerPoint, Anna, if you want to share it, please. Is there a way to, oh, okay, thank you. All right, so we are, for those of you that don't know us, we're Esperanza. We are a 51-year-old global health organization. And our mission is to build health equity through improving access to health education, disease prevention, and treatment. And we work with partnerships to deliver programs and services in Bolivia, Peru, Ecuador, Nicaragua, Mozambique, and Arizona as well. So Anna and I work more closely with the international program, but we do domestic work as well here, where we provide health education and resources to at-risk and underserved Latino youth, adults, and seniors. Could you go to the next slide, Anna? So this infographic I really appreciated just because it showed the displacement of all of the areas in the Goal 3 and kind of the data and stats prior to COVID and then the effects of it afterwards. And Anna touched on this when she opened up, our meeting today. But I think it's really important to highlight these areas and in terms of maternal and children health, immunization coverage, reducing communicable diseases, and how that's affected all of these areas due to the pandemic. And there was a stat in there that kind of explained that over, 90% of the countries are still reporting disruptions of essential health services. And these encompass areas of HIV, Hep B, Hep C, cancer screening, services for non-communicable diseases, diabetes, family planning. So I think this infographic was really important to just kind of show where we were at and where we are now. Could you do the next slide, Anna? So this infographic basically just shows us the 3 different target areas. The SDG goals have it really nice on their website and kind of describe different target areas and also really specific indicators. So these are the 4 target areas that Esperanza encompasses. So the first one is fighting communicable diseases. Secondly, reducing mortality from non-communicable diseases and promoting mental health. The third is achieving universal health care. And then lastly, reducing illnesses and deaths from hazardous chemicals and pollutions. And so the partners that I'm going to be specifically highlighting on are from Mozambique, Peru, Nicaragua, and Bolivia as well. Next slide. Oh, could you go back one, Anna? Sorry. Okay, so for this one, the indicator is number of new HIV infections per 1,000 uninfected population by sex, age, and key populations. And so the overall target, like in the previous infographic, the target 3 by 2030, they would want to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, hepatitis, waterborne diseases, and more specifically, the new HIV infections has declined in sub-Saharan Africa, which is the region with the highest number of people living with HIV. And then even though there has been a decrease, there are still major disparities in terms of access to HIV prevention, testing, treatment services, and evidence has shown that the COVID-19 pandemic has, created those disruptions even more to getting those services, getting testing, getting medication. And how it relates to the work that we do, Mozambique hosts these support groups to raise awareness about preventable diseases and showing how we respond to, issues about, sanitation and hygiene, HIV, people living with HIV and AIDS. And what's really great about the work that we do in Macian, Mozambique, is that these support groups help these individuals, share their testimonies, and there's health specialists and health activists that are able to provide nutrition information and counseling as well. And this woman in the picture, Filomena, she is HIV positive, and she supports or she participates in the support groups And she also, every month, our community health activists, they go and travel to the hospital to get the antiviral medication. And so she at times travels with the community health activists to obtain those medications and then bring them back to the community for individuals that are HIV positive. Next slide. So the other indicator is mortality rate attributed to cardiovascular disease, cancer, diabetes, or chronic respiratory disease. And more generally, target 3.4 talks about how it looks towards reducing 1/3 of premature mortality from non-communicable diseases through prevention and treatment, and promoting mental health and well-being. And these stats were alarming, or to me, but for the non-communicable diseases, the NCDs, 70% of all deaths in 2019 were caused by the NCDs. And for those of you that don't know what the NCDs are, that encompasses cardiovascular disease, cancer, diabetes, and chronic respiratory disease. And how this relates to the work that we do. So in this photo, Bolivia, they have a long history of implementing effective health programming and for young adults. So in 2020, our health program staff led 4 health awareness campaigns and held 7 health services educating participants in the NCDs and mental health prevention as well. And some of these trainings focus on leadership, training for young adults, who then went to establish and lead 5 support groups for the prevention of NCDs and mental health disorders. And from that, a total of 59 people were participated in the support groups. And in addition, in 2019, Esperanza also offered training opportunities for health prevention, for health professionals for cervical cancer treatment as well. And that provided, pap smears for women. And then in addition, since 2017, Bolivia has partnered with the Child Fund International Organization, and that with that they are able to engage with children, young adults, mothers, the entire family to work on prevention education for health, nutrition, and domestic violence as well. And then in this photo, the Esperanza Bolivia, they work on a mental health promotion project, which provides emotional support to the areas most at risk. So students who participate in this are chosen by the principal and faculty. And the therapeutic groups place an emphasis on gender-based violence, and then also just recognizing emotional limitations and how to change and adapt those behaviors. And then next slide. So for this one, the more specific indicator talks about the coverage of essential health services. And this was really exciting for me because it just showed how integrated we are in this one specific goal. So more generally, it talks about, achieving universal health care, but also providing access to quality essential health care, whether that's, affordable medicines, whatever that may be. And so again, kind of going back to the infographic, prior to COVID-19, there was an estimated 927 million people out of the global population that, paid out of pocket for their health payments. And Esperanza, we've done, a good job at, bridging that gap of individuals that couldn't pay for services, and, actually going into the communities to provide those services. And so as you'll see in this photo, this was recently from one of our primary care brigades. And what we usually do is we send our local nurse in country, local nurse and physician to travel to these rural communities in Nicaragua. And this initially started because in 2018, there was a lot of political instability in Nicaragua. Most of our surgical trips went to Nicaragua. And so they decided we're just going to adapt and bring services to the communities using the local personnel here. And eventually it turned into doing local surgeries with the hospital staff. So it's developed, and our partners there have done a wonderful job at just kind of adapting and creating new programs that are still meeting the needs and bridging that gap for health services. So our local nurse and physician, they travel with a pediatrician and a dentist as well. And so in 2020, they saw over 2,400 patients in 4 different communities. And like I mentioned, we were able to adapt and work with the local hospitals, the local staff to do trips. And we were able to kind of sneak in one trip in January of 2020. But in terms of sending surgical volunteers from the States there, we have only done that one trip in January 2020. But, fingers crossed, we're hoping to get things started again. But, we are just planning tentative trips right now. But our communities and our partners have done such a wonderful job at, still providing these primary care brigades, and then also doing the local surgeries as well. And another thing that I wanted to mention as well, in Peru, we actually launched a primary care program which addressed the high rates of anemia and intestinal parasites among children in the Queros community. And so this kind of encompassed oral health and food hygiene workshops for parents, teachers, and children as well. And this community is just very, disconnected from any type of health services. So the need to bring those type of, health services, educations to the specific community was really imperative. And then we were also able to send one trip to Peru in November of 2019. That was our last trip there. But it was still, we were still able to provide ophthalmology services to the community. And I think that's it for this slide. Do you mind going to the next one, Anna?
Can you see it?
Yeah, I said the next slide. Sorry.
I moved to the next slide. You can't see it?
Oh, no. But I think that's, yeah, that's pretty much it. That's the, you know, the kind of the four targets. The last slide is just our logo, but yeah, I think it was just a really, I don't know, I think it was just really cool and really interesting to see how our organization aligns with all of these different targets and indicators. And I learned a lot, and I think it was truly incredible just to see the connections and how we're aligning with these SDG goals. But if anyone has any questions, or Anna, if you want to add anything, please feel free to do so.
I think you made the very clear connections between the specific, I thought that was really cool, the specific indicators underneath goal 3 and how our work is, you know, slowly but surely chipping at it. I think you drew very clear connections to that, so I appreciate that. But I'd like to open it up if anyone else has questions, comments about Adriana's presentation.
Is there anything your Esperanza does not do health-wise, like that you have delineated that you're not? Because I started writing down things and I'm like, okay, you know, HIV support, ophthalmology, you know, pediatrics, gender-based violence, mental health support. I'm like, oh my goodness, it's so much more extensive than what I don't know why I thought you only had like a key couple surgical areas you did. So what don't you do?
I know, and it was just so. And it made me curious because I wanted to kind of go through all the goals and see, hey, how can we say we align with this, or how we're integrated into it? And I think that's like the global health, public health side of me, just curious and interested on how things are so integrated and connected. But I think I learned a lot because I did a lot of like research going back to our programs all over. In all of our different partner countries. But I know I'm trying to think about what we don't do, because we get that from our interns all the time. They're like, oh, you're doing this now, you're doing that now. But I think that's what's super cool is everything's just integrated into not just health, but education and all of these new areas that we're trying to explore and grow within our organization, because we do focus on health equity, but I think we're learning as an organization how we can broaden that and how health is integrated into so many aspects of an individual's life. But I don't know, Anna, if anything comes to mind of what we don't do.
Well, I don't really have a direct answer for that. And the reason is the services that we offer, the programs that we implement are identified and developed by our community partners, because they base it on the needs of the community. So it's hard to say like, we don't do this, we don't do that, because it might come up as a need, as a priority, as an area of, you know, opportunity. So even if we had like certain limitations, I feel like in the next couple months or in the next year, someone might come up and say like, actually, that's something that we really need. And we'd be like, okay, well, let's figure out how to do it. And that's really the basis for our entire model is we work from the ground up. That's why we work with local grassroots nonprofit organizations in each country that we work with, because they know the communities best, right?
Mhm.
Amazing. So serving the need first. You show up and you ask, and so that's a really beautiful model. And you're in the health equity theme in your service. It's really.
Any other comments, questions at this point? If you have any questions or comments you want to make about any of the presentations, we have a couple minutes left before we close out. Any final thoughts or words of wisdom you want to share?
Well, I don't know that these are words of wisdom, but I'm certainly sitting here thinking, oh my gosh, what amazing things all of these organizations are doing, and how can we let more people know what we're doing so that we can accomplish even more. That's my goal.
We're thinking along the same lines.
I was just curious, do you guys invite others to join you, or how would others find, you know, the Arizona Global Network, and how we could, you know, grow it? Because I was just thinking, just hearing y'all's presentations, like it'd be so awesome to, you know, have other people hear what, you know, all the important things that everybody's doing.
Yeah.
We are very enticed and enthusiastic about any kind of joint project. So we would be happy to integrate in any way, shape, or form. Just get in touch with either me or Sherilyn or Jenny. And I'm just Annabelle, ANABEL at 6 seconds, and you can reach me, .org.
Oh, that's awesome. I love the collaborative spirit. That's really why we're all here, I think. And the way that we've been growing little by little has really has just been word of mouth. Anyone that is in the network that comes to these meetings, if they know of any other organizations in Phoenix and Arizona that might be interested in joining, we just, you know, kind of add them to our email list and they show up as they can. Most recently, I've been encouraging the people that do show up to meetings to invite other people in their organizations. As some of you have been recipients of those invitations, because I think it's just, you know, the more the merrier, and the more that we can share about our programs and opportunities, you know, there can be more potential for collaboration. And I think that's where the juiciest part of our work can really start, is when we start, you know, thinking creatively about how we can help each other out, get closer to these goals. So yeah, if you know of anyone that might be interested, or someone that we can reach out to, just send them my way and I can definitely close the loop on that end.
Great. Thank you. Thank you very much for today. I enjoyed it. Thank you.
That's great. Well, if there aren't any other comments, thank you everyone for your participation. This is so exciting as the kickoff to our to this installment, if you may. The next couple of months, we're going to be going through the rest of the goals. So I hope that you come back and can listen to some of the other members present on their work. I think it's going to be very informational, very educational, inspiring, all the above. So thank you again.
Thank you so much, everyone.
Thank you.